Good afternoon, everyone. Welcome to the YWCA Mahoning Valley's 9th annual Stand Against Racism. I'm Leigh Merritt, President and CEO of YWCA Mahoning Valley. Stand Against Racism is a movement that was initiated by the YWCA to raise awareness that racism still exists in our communities and that it can no longer be ignored or tolerated. Our objective is to bring individuals and organizations together who believe, like we do, that united we can eliminate racism. This week, we join with over 200 other YWCAs in the stand. The national theme is Racism as a Public Health Crisis. We will focus our program today on how that impacts birth outcomes and maternal health for women of color. As many are aware, the infant mortality rate is double for Black women compared to white women in our community. YWCA has been on the forefront of racial justice and social justice work for a very long time. Eliminating racism and empowering women are not just words, they're our mission, especially when it comes to the intersectionality of gender and race. I would like to thank the YWCA board members, chaired by Dr. Krishana Jackson. They've been very supportive of the stand and our racial justice work. Their belief and advocacy for the YWCA mission of eliminating racism and empowering women is key to our success, and you can see them listed there on the screen. We'd also like to thank our committee members who helped us plan today's event, and I would like to take a moment to recognize our committee today. That screen is being shared with you as well. We can't do these events without all of you helping us to plan and promote them. So thanks again. Also, thank you to the Nancy Morris Endowment for the financial support of today's program. But before we get started, let's have some housekeeping. This is a Zoom webinar, so you're all muted and off camera except for the speakers. But we do encourage you to use the chat feature to enter comments or questions for the speakers or the YWCA. We do want to know where you're joining us from today, so please enter that into the chat if you've not already. And thank you so much for attending. We know many of you are already doing this impactful work of social justice, and we are all collectively working towards peace, justice, freedom, and dignity for all. Today, you will see several videos of women and the journeys of their pregnancy after birth. You will be viewing the responses to a few questions that they were asked about their pregnancy and delivery journey and the health of their baby. They were also asked about housing as a barrier or a benefit. Then we will have our expert speakers presenting their work interspersed with the videos. So let's watch about Maria and her journey.
I was high risk during my pregnancy because I had gestational diabetes. I'm in recovery. This was a repeated C-section for me. Plus, my age is just right where they like to, keep a better eye on you while you're pregnant. I didn't have consistent housing for my child, and I just with the pandemic and me starting out on my own, it just seemed like way too much to ever accomplish. Just having a home for us, and so I found myself like moving from facility to facility. When I really started looking, I was about 5 months pregnant. And I was kind of directed along this way. The labor and delivery went really well. They were really calming and reassuring. It was a comfortable experience. There was a lot of blood loss, but they didn't really let me know anything about that until afterward. They got me right back in shape. It was a really good experience. My baby is now 6 weeks old. He was born on March 3rd. Through the YWCA, I did find housing, and it helped out drastically with the stress level, with my, ability to just put everything toward being a mom toward him right now, and not having to worry about things that you have to worry about if you don't have your own place. I am able to, focus all my attention on him in a calm environment. It's clean. I can spend more time making sure he gets everything he needs, and pay attention and take care of my own health, cook healthy meals, and stuff like that, because it is our space. There's really not much else to worry about. The only advice, well, actually, I have a lot of advice for anybody in my situation, is just like follow the resources. Take suggestions. There's people here to help. Don't give up. If something's suggested, just go for it. People are really ready and willing to help, and it's done a world of good for me.
We thank Maria for taking the time to share with us how things went along her journey. Now we're going to introduce Dr. Nicolette W Poe. She is an MS and a Master of Certified Health Education Specialist. She is the Assistant Professor of Public Health in the Department of Health Professions at Youngstown State University, and she received her Doctor of PH Public Health in Health Education from Loma Linda University, an MS in Health Promotion and Human Sciences from North Carolina Central University, and a BS in Community Health Education, Healthcare Ethics from Kent State University. Dr. Poe is a public health scientist whose primary interest is behavioral risk factors for chronic disease prevention. Dr. Poe's research investigates racial, ethnic, and sex differences in adherence to cardiometabolic self-management practices, specifically in young adults. Dr. Poe also studies applied health education theories to implementation of health promotion programs and dissemination of chronic disease program outcomes. Her work has resulted in the publication of Racial and Ethnic Approaches to Community Health, Minority National Organizations Success Stories Showcasing the Health Equity Project that worked towards closing the health disparity gap in at least one of the racial and ethnic minority groups. Dr. Poe serves on the Youngstown American Heart Association Board, Planned Parenthood of Greater Ohio Board, and she was elected to the Society for Public Health Education Board of Trustees for Professional Development. So I think she really knows what she's going to be talking about here today. And Dr. Poe, we really thank you for joining us. And we'd like you to share a little bit of information on the rates of infant mortality and how they differ by race nationally and locally, as well as how racism impacts women of color during pregnancy, regardless of socioeconomic and healthcare availability. Dr. Poe?
Good morning. Thank you so much. If you could make me a co-host, I could share my screen. While I wait for that, one of the things that I want to do today is try to make this personable. And I only say that in the sense of the reality is that there are so many factors that contribute to why we see infant mortality, right? And so being able to look at that and consider the factors that contribute to that, and most importantly, thinking about what are those social and physical factors that contribute to infant mortality? And I say that because today I have asked a young adult, since my interest is in young adults, to kind of share their experience with what we see today. One of the things that I think is really important is to always consider how and where things can happen. And I say that in the sense of when we talk about those factors, when we think about racial and ethnic issues that contribute to the disparities in infant mortality, we have to think about what is happening in that community. And I say that because it's critically important to understand what's happening in a given community, to understand where to go and how to overcome. And so because of that, one of the things that I have found to be critically important is this notion of what are those contributing factors. And so one of the things that I like to always try to get people to think about is this notion of why is this so important, and why do we need to talk about this? Why is this such an issue that we need to talk about? I don't know why this is happening. I apologize. My screen is not, it's sharing, but it's not sharing what I wanted to share, and I don't know why that's happening. So this is what I'm going to do. As a trained health educator, you just know to keep moving and work with or without what you have when technology works and when it doesn't work, right? So that's what we're going to do today, is keep it moving. So one of the things that I want to make you aware of, just in case you didn't know, is the fact that in the state of Ohio, Ohio is place number 7 when it comes to infant mortality. And right here in Mahoning County, the mortality rates is like the 3rd highest in the state at 9.7% of life per 1,000 life births. And for Black infants, that risk is 3 times as high than other ethnic groups. And that is a critical issue when we talk about infant mortality and what is contributing to that. So one of those factors is racism, and racism and pregnancy is not a good combination. One, if you just think about the fact of just racism by itself, and then you compound that with the notion of pregnancy, that just is like, just makes it worse, right? And so because of that, one of the things I want you to think about, imagine this. Imagine a fully loaded jumbo jet with about 220 passengers in the crew. They're taking off and they're crashing today. And the same thing keeps happening every day for the next week, every day for the next month, every day for the rest of the year. That's exactly what's occurring when we say that racial disparities in health is happening in the United States. And this is particularly true when we think about African American people who are disproportionately more likely to die prematurely. And this is especially true when we talk about infant mortality. And so if you imagine the impacts of racism, the everyday discrimination, it's like a daily chipping away of your quality of life. So, and then you think about how that looks and feels on a day-to-day basis. It could be something as simple as being disrespected when you go and visit a place. It could be how you're treated. Are people courteous to you? How you treated at a restaurant? Are people afraid of you? All of these things contribute to those health outcomes. And ultimately what that creates is adverse health conditions that can contribute to hypertension or high blood pressure, diabetes, and poor mental health. And so that is a great concern when we talk about racism in pregnancy. So another issue that we have to think about when we talk about how this really impacts maternity health and racism is thinking about many families live in fear or in a state of maybe the fear of someone or the county coming and taking their children, or maybe the violence or neglect, the fear of violence that they may experience on a daily basis. Or perhaps it could be increased criminalization among African American women and their partners. This can be resulting in Black people being overrepresented in the jail and the prison system. Or perhaps it could be the existing of health funding, or perhaps the lack thereof. And that could be something as simple as lack of health insurance. And when we consider the factor of housing and environment insecurities, one of the things we also have to think about is food, income, and the reality that these are factors that contribute to um, unhealthy living, as well as how that looks and feel on a day-to-day basis. And that's simply the daily stresses. Perhaps some may say of racism, but some people may say the daily stresses of just living life. And so when you deal with these stereotypes and these racial profiles that are contributing to that, some can say this creates these ongoing traumas. Some are bigger than others, but those are realities. Perhaps there could be disabilities that are happening. And when you think about this happened over a historical period of time, that becomes even more traumatic. And so it's this whole ideal of transgenerational trauma that happens on among families, from generations to one generation. That feeling where you feel, or you have that feeling that you or your parents or your grandparents have lived through some traumatic experiences, and how that shows up in a woman's health, and that again can impact and have an influence on infant mortality. So one thing that I want you to think about when we think about stress in pregnancy, when we think about, just the stress of just being pregnant, right? And thinking about how that may be, your body's changing, your hormones are changing, you have mood swings, you have negative life experiences, you have, the feelings of depression and or anxiety that can be just contributing to just trying to, how am I going to take care of this baby? How am I going to find a safe place to live? How am I going to take care of myself once I have the baby? How am I going to keep my job when I cannot work? How am I going to pay my bills if I don't get paid, if I don't go to work? All of these factors contribute to housing insecurities. And so I want to just talk a little bit about what the My Baby's First Coalition has discussed in our meetings about housing and those insecurities. And what some of the things that we've talked about has really been focused on this notion that when we think about the intersection of healthcare and cultural competency and how that intersects with housing, it's a big deal because one, there could be issues about how people feel that they're treated when they do seek service, whether or not they have the quote unquote good insurance or insurance at all to seek and receive the services and the care that they need. And then thinking about where you go to regroup or to recharge, having that safe environment that you can go to that is a safe, affordable place. And I have you think about this, thinking about the available housing that exists in this area. There's not a lot of new buildings that are being, or housing properties that are being built. So you have to deal with older homes. And sometimes older homes can come with a variety of health issues. And because of that, that can contribute to unsafe housing. And most importantly, could ultimately contribute to the potential of people experiencing homelessness. Because again, they got to have a job, they got to have a source of, be able to pay their bills. The house may not be a safe place to stay, but that's where they find themselves at. And so our challenge as the coalition has really been looking at how all of these, as we refer to it in the healthcare arena or public health arena, is all of these social determinants of health, or these contributing factors, may they be physical or social factors that are contributing to why we see the numbers so high when it comes to infant mortality. And one of the solutions that we've considered is really thinking about how can we begin to repurpose the housing properties that we do have available. How can we get new builders and investors to invest in repurposing our spaces, or in this case, building new spaces that could be utilized among our communities. And so one of the things that I wanted my guest speaker to our Kiera Price to talk about. She's a graduating exercise science senior. I wanted her to kind of give that social perspective in regards to how social support is so critically important when we're thinking about, how do we address infant mortality as it relates to the stress, the racism, and the housing issues that we face within our community.
Hello. So I cannot speak for myself because I don't have any kids, but I have a friend who has a baby. And she has talked to me about the social support she has had over the years, past 3 years since her daughter is 3. So the first would be the financial help. My mom always says it takes a village to raise a child, and she has recognized that village has really helped her raise her child financially. Without the financial help, she would have to work multiple jobs in order to support her and her daughter, such as putting food on the table, providing clothes, basic necessities, and paying her own bills. She has an in-house babysitter. She has 5 siblings and 2 parents. So that helps her save money with babysitting. She also works a night job. So if she did not have an in-house babysitter, she would have to find a 24-hour daycare in order to watch her child overnight. She is also in school. She's a full-time student. So the financial help has helped her there. She's able to pay for her tuition, and she's able to save money by not having a babysitter. Once again, just having an in-house babysitter. She's also able to focus on her mental health. She has suffered postpartum depression after having her baby, and she has noted and thanked her family so many times how they have helped her get through the postpartum depression and helped her to develop a routine with her baby, because if not, she said she wouldn't know how to get through it. She has also received support after delivery with care, cleanup, groceries. Have to live with her after she gave the baby. Everybody did for her. They provided food, grocery shopping for her, cleaned her house, and things such as that. And then back on financial health, she does live with her father, fortunately, so she does not have to worry about rent. But she know that if she did not live with her father, she wouldn't know how to pay for rent, and she would most likely end up homeless or couch hopping because she wasn't able to afford it with the job she has. To conclude, what I talked to her about, she said the village she has had has been nothing but supportive, and if she would do it all over again, she would love to have the people in her life to support her once again, not only financially but mentally, because they have helped her mental health as well.
Thank you both so much. That was very insightful, both from the personal perspective as well as the broader health perspective. Okay, now it's time for our next video. I'd like to introduce to you Precious.
When Romello had finally came and was delivered, I was transferred over to the mother and baby side, and I was still kind of under the medication they gave me for the pain I was dealing with before he came. So I didn't really realize his arm, but I'm hearing my family, my mom, my fiance, his arm isn't moving, Precious. His arm is purple, Precious. I'm not understanding why it looked like this. But I'm not comprehending because I'm still under the medication. By the time I made it to mother and baby side, I finally was able to hold my baby. Once I held him, I noticed his arm it kept falling. And I kept asking my nurses, and they was like, the doctor will be in to talk to you about it. The doctor will be in to talk to you about it. Once my doctor came in, she talked to me, and I did not feel like she completed what I asked or made me feel comfortable. So she had stated that. I said, well, how long, will it take for his arm to come back, or what's the next steps, I should take? And she said, you're gonna go to the pediatrician, but it will come back in 3 months. And when she said that, she said the arm will come back in 3 months. It will come back in 3 months. And I'm like, this is serious. I mean, my baby's arm is purple. And after that, I never seen her again. I never seen her again. She circumcised them, and I never seen them again. I seen her again. I made it to my pediatrician the day we got out of the hospital, and she said, oh, this is severe. It's not gonna come back in 3 months. So that's when she sent me to, he had to do physical therapy 4 times a week as just a newborn, and it's not like he couldn't do much. But she sent me to the physical therapy 3 times a week, and then we met with a doctor at Akron Children's in Boardman. Akron Children's, Dr. Little is his name. He's a great doctor. I love him to death. And that's who did the surgery. So we met him at Akron, and he stated that this isn't his office, but they noticed that his case was so severe, and he needed to be seen right away. So, he traveled up here to Youngstown, and I was so thankful over that, because he said he dealt with so many cases of brachial plexus, but his was the most severe he has ever seen. So I had got an appointment right after seeing him. They ran their x-rays and things like that, and they told me that the hospital didn't run x-rays, so they had to do x-rays themselves. He gave me a referral, not a referral. I had to go up to Cincinnati where his actual office is, and we met with his whole team, and his team is excellent. I would definitely say excellent. So yes, but I had a good support system after, he came, and I had, a lot of help, a lot of references, but the doctor that delivered him, I felt like I didn't have any help. So I will also say, when you do go to appointments for a pregnant Black woman, any pregnant woman, do not be scared to ask questions for your child. And I'm here today. I did have a second child recently, about 6 weeks ago, and I had to have a C-section due to what happened to him. And so on. If I was to have more, I have to have a C-section because of my pelvis being so small, and I didn't even get that checked. So.
Wow, what a journey. So glad that she was able to advocate and get some good resolution to that. So now we'd like to bring on our next speaker, Leigh Greene. For 18 years, Leigh was the Director of Social Services for an African-American owned and operated skilled nursing facility whose residents were predominantly African-American. In 2014, she became the Director of the Youngstown Office on Minority Health. The office gives a considerable amount of time in informing, educating, and empowering the minority population to take a more preventative role in their own health. As director of the local office, she's given a great deal of focus to educating the community on the high rates of Black infant mortality and the greater Youngstown community. She is a core team member of the Mahoning Youngstown Babies First Coalition and sits on many of the coalition's subcommittees. She's the co-chair of the Greater Youngstown Community Dialogue on Racism, GYDOR, and with the members of the My Babies First Coalition released the video Dads Do Matter, and that is to target the fathers and the at-risk community. Leigh recently graduated with her Master's in Social Services Administration with a concentration Community Practice for Social Change from Case Western Reserve University, and she plans on continuing her passion to enhance the work of the office, concentrating her efforts on health equity, removing barriers and access to care, and improving social determinants as it relates to quality of life for residents living in Youngstown and the surrounding areas. Leigh, welcome, and will you share some of the work your office is doing with the community health workers and the hub?
Yes, thank you, Leah. Hello, everyone. So what I decided to do was just do a brief overview of what the Office of Minority Health is basically about, how it came to fruition here at the Youngstown City Health District. And then also how it and the Youngstown City Health District are involved in efforts to improve the health and birth outcomes for our infants, is primarily our African-American infants. So prior to becoming an actual department, the Youngstown City Health District, the Youngstown Local Office of Minority Health, was funded by the Commission on Minority Health from its beginning in 2008 to 2015. Currently, the city of Youngstown shares over half of the funding of the office, and the commission then funds the remaining portion of that. So prior to that, we were solely funded by the Commission on Minority Health, which as I go on in my talk, you'll see how important they have been in the process of answering the call to our tremendous Black infant mortality in this community. The very first meeting that I attended as director was an OEI meeting. So that was the Ohio Equity Institute Coalition meeting, which would later become known as My Baby's First Coalition. The coalition was already started and in its second year of planning its upstream and downstream initiatives in the answer to the state's call on reducing the incidence of Black infant mortality. The upstream was the establishing of the first centering pregnancy that would be in our community, and that would be based at the Women's Care Center at Mercy Health. The downstream was looking at birth spacing initiatives. There was also a variety of support programs such as Resource Empowering Moms and Safe Sleep that were associated with the My Baby's First Coalition. Around the same time, the Commission on Minority Health, so that is the funding entity for this local office, opened a round of funding to establish a Pathways Hub. So the Pathways Hub was a successful program in Mansfield, Ohio, started by Doctors Redding, so that was a married couple. And they established using community health workers to improve birth outcomes in their community. And they saw record success in that program. And the commission wanted to adopt that and use their model in other communities. So they actually funded helping us initiate our initial hub. So team members that were actually on the My Baby's First Coalition, which were our two health commissioners, Aaron Bishop and Pat Sweeney at the time, myself, and I think there were several other members who actually sat down to pull the grant together. We were awarded the grant, and we were to find and implement the use of community health workers to support our at-risk moms in reducing the incidences of Black infant mortality. The Pathways Hub is coordinated currently through the Mahoning County Public Health and works with various agencies that are already providing maternal health programs with the support of community health workers. So there are approximately 7 to 8 programs that are actually employing community health workers and that are supporting maternal health outcomes. So the hub actually has, I want to say, has made it's an umbrella, so to speak, so that it kind of ties in all these programs. And then there are other resources that are like a spoke in the wheel. So they actually address some of the social determinants of health that may be preventing that particular mom from having the most successful pregnancy. So just to kind of briefly touch on what are the social determinants. So we're looking at economic stability, neighborhood and physical environment, education, food, community and social context, and community and healthcare systems. So in economic stability, we're talking, of course, about employment, income, expenses, debt, medical bills, and support. So that we're talking about financial support. Neighborhood and physical environment, we're talking about housing, transportation, safety, parks, playgrounds, and walkability. Are your streets safe for you to walk? Are your sidewalks maintained so that you can get exercise? Education, literacy, language, early childhood education, vocational training, and higher education. So are you able to obtain those various aspects of education to provide a better life for you and your infant? Food, hunger, access to healthy options, of course. And as a caveat to that, we do not have a localized grocery store in our city. We have some that are on the outskirts of the city, but nothing that is localized or convenient for the majority of people who live in the city to access, other than your corner stores, which probably are not providing, or we do know that they aren't providing the nutritional benefits that you could get as fresh fruit, vegetables, fresh meat from a grocery store. Community and social content, social integration, social support systems, community engagement, discrimination, which I like to /tag racism, and the healthcare system, health coverage, provider availability, provider linguistic and cultural competency, and quality of care. So just addressing, I was struck by the two, and I was not aware of the videos prior to. We did know that we were going to have videos, but I was not aware of the young ladies who were going to speak. So in the case of Maria, that she was talking about the social context and how it was important to have the support and those individuals who were there and helped her in support, so that also, which one of the social determinants that we were also looking at in our coalition being housing is a huge problem. And as the young lady spoke, Dr. Powe, housing and it is a huge issue. And the fact that you don't have to worry about where you're going to sleep, where are you going to stay to take care of your baby, hopping from house to house, and you're not able to provide the care that your child needs because you might be leaving articles behind as your house hopping, and then also the stress of just wanting to know where you're going to be the next night takes away from the energy that you can give to your infant. So we looked at certain things and we realized that those women who were participating in the hub were actually having great outcomes. But then when we look at the overall picture of Youngstown and the Mahoning County, we realize that these our women and especially our Black infant mortality rate is still very high. So even though we have programming, we have the support of community health workers who are answering some of those social determinants that we see or that we have briefly talked about, we actually realize too that we are responsible as a community to help that birth outcomes for women who are not in our program. So what we did, we specialized in social determinants and formed committees. And we looked at some of the things that our women in the program were having difficulty with, which was housing, transportation, and access to food. And we formed 3 different committees, and each committee was given a responsibility of trying to investigate what the situations are in our community and how we can implement change in that. So, of course, the impact that the YWCA has had on providing housing for at-risk women have been huge asset to benefiting the birth outcomes. We've also worked with metropolitan housing so that women who are pregnant are moved up to the top of the list if they are already on that list. We still have a ways to go because of a certain situation now that our community health worker that we have in our Moms and Babies Matter program parent was facing is that you are not considered homeless unless you are really homeless. So her problem or her situation was that she was living with the father of the infant, but they were not getting along. But she was fearful that if she moved to the rescue mission or to the Attitude House or somewhere to seek shelter, that would give the father an advantage to say, you know, that she could not properly take care of the child. So trying to find housing for someone who is not necessarily in a housing crisis, even though their situation is not favorable, are still things that hopefully that we can kind of work out or have some type of emergency housing down the road to help situations to that end. But also we have had success in transportation. So I know that people in the committee a couple of years ago decided that they would have a meeting out at the mall, and everyone wants to take local transit, the transit system, and meet at the mall for this particular meeting. And what we discovered, which many of us are fortunate enough to have cars, and if you have a car, that's huge, and you really can't reflect on the impact that having to do several transfers or having to plan your day or having to waste a whole day just to get from one place to another kind of gets taken for granted. So we all kind of were able to do this experiment. I just heard the report on it. I didn't take part in that particular day, but then it happened to rain on top of that. So then some of those individuals got rained on. I did a presentation just a couple of days ago, and I said individuals really do not know that being underserved or being poor, for lack of a better word, is very expensive and time consuming. And to help alleviate some of those stressors as far as transportation, which WRTA now has free transportation until June, and I'm hoping that they do eventually find more grants and programs. And then also the hub has been able to kind of maintain some type of transit so that women who, of course, if you are on a managed care plan, have transportation available to you, but then you have to share with individuals who may be seeking cancer care treatment or dialysis treatment, which actually puts you behind in scheduling as well. So either you arrive super early to your appointments, or you're not picked up till super late after you have already seen the doctor. If you're riding shotgun with your children, then you have children who are whiny, sleepy, hungry, and it's just totally inconvenient. So we are just looking at alleviating some of those things. And then of course, there is always individuals in our community who are working on access to food and maintaining tickets so that you could get double food, double vegetables and so forth, vegetables and fresh fruit and so forth. So there are many programs that are there that are trying to access the problem. Resource Mothers actually has cooking classes for their moms, Empowering Moms, Resource Moms. Have cooking classes, actually go to the grocery store and look at nutritional values of food and so forth, and meal plan, which some of those things are, you know, when you're in a crisis situation, you really don't have an opportunity to look at. But I just really wanted to talk about the last story, Precious's story, kind of made me think about some of the ways where Black women and Black infants have a struggle or sometimes are not taken care of appropriately in hospital situations. I think community health workers and doulas are a perfect answer to that, to have that support. But to know that the Precious needed a cesarean and she was still, the baby was still just pulled vaginally, which damaged the side of the baby's body, that was crucial. And you could consider that bias or racism, because I think in maybe any other situation that maybe her care or the baby's health would have been taken more seriously. So I don't know the situation, but these are where we look at instances of racism and inequity in healthcare and so forth. So there are just to touch base on a topic that you could talk about for several hours, but just to give you a kind of brief understanding of how the Youngstown City Health District, how the Office of Minority Health helped to implement some of the programming that we see now. Actually, not only having those social determinants, but the Youngstown City Health District also has the Reproductive Health and Wellness Center. And then we also have Moms and Babies Matter program, as I mentioned earlier. So there are numerous Akron Children's, Mercy Health, other organizations that are actually working with community health workers to implement the programming and to find access to some of those things that are preventing care to the women in our community, and definitely helping to remove some of those social barriers.
Leigh, that's great news that things are looking up. Things are being culturally competent. It's being improved towards cultural competence. I think we have a long way to go, but thank you for sharing that with us. And we will have some time for questions for our speakers soon. But now we're gonna watch our last video of Shidaria.
During my pregnancy, I did have risk and complications. I had a miscarriage back in 2019. With the complications with that, I had a low cervix, well, it's called a short cervix, which I encountered with my second baby as well. But with the first baby, they wasn't able to catch it fast enough, so therefore I had a miscarriage. With the second baby, they were able to catch it since it happened before, and they were able to prevent it from happening faster. I did not have affordable housing when I first became pregnant with the first baby, so I had to look for a home for my family. With the second baby, I already was in the home, so it was easier for me to do things. I was 2 months pregnant when I first started searching for a place to stay with the first child. And my labor and delivery experience the nurses was awesome. The doctors were good as well. It was only hard because I had to be in the hospital for over 2 months to try to keep the baby in as long as possible with the second child. The first child, labor and delivery went very smooth because he was under a pound. Now my second born is almost 1. He'll be 1 in July. He was born July 10th in 2020 during the pandemic. I feel more confident with the health of myself and my 9-month-old baby because things are getting a lot better for us. At first it was hard. He had to be in NICU for 2 months before coming home after birth. And I had to stay in the hospital for about a week after birth instead of being able to come home within the 3 days because of a lot of complications that we were having. The advice that I would have for anyone that's pregnant is as soon as you find out, go see a doctor and make sure that everything's okay. Make sure that you make all of your appointments. If you need to find a home for yourself and your child, do so as soon as possible. It'll help prevent a lot of different things that you would never think that you would need to prevent.
So we hope you've enjoyed our videos today. I think each one told a different story and a little bit of a different perspective, but it's clear that there were challenges along the way for all of them. And it's exciting to hear about some of the work that's being done in our community. Do we have any questions at this time for any of our speakers? I'm not seeing any in the chat box. While we're waiting for that for 1 minute, I just do want to thank so much Michaela Wright, who filmed and edited all those videos and is working behind the scenes today, along with Varda Bidet, who is our Chief Operating Officer. So we couldn't have done this today without them. So I guess actually we want to bring up our next slide, which is our call to action. So there are a lot of opportunities to speak out to your legislators. There is a lot of work going on around declaring racism as a health crisis. There's work locally happening on our coalition, our MAGIC coalition. There's a lot of things happening and planning. It's going to be a long road to actually see those drastically improved outcomes. But these are some ways that we can get started. So we have the End Maternal Mortality Black Maternal Health Momnibus Act. And actually, Michaela has just shared with you in the chat box where you can go directly to the Action Center at the YWCA USA, and they make it real easy for you. You can just link on to these various legislation proposals and show your support for those, as well as take our online pledge against racism. We also have the COVID-19 Hate Crimes Act, and the demand safety, accountability, and justice for all, strengthening and pass the George Floyd Justice and Policing Act. So, you know, it's great to do the work on the ground, and the YWCA, as many in our community, have been doing that for a long, long time, but we also need to be thinking about those policy opportunities and how our voices collectively can make for better outcomes for all of us. Because as my little button says, you know, racism hurts us all. It impacts us whether you are directly impacted or indirectly impacted. So I'm not seeing any questions. That must mean that everybody did a great job. So I'd just like to bring on Dr. Poe and Leigh one more time here to thank them and show their lovely faces. So thank you so much for joining us. We hope everybody links onto the chat and to the Action Center for the YWCA declarations and pledges for our stand against racism. And look forward to more programs and services coming your way.
It was a pleasure. Thank you.
Thank you. Okay. Thank you all. Have a great day.